What led us to explore this concept of genitourinary syndrome of lactation, or GSL as we like to call it, is really this idea that emerged from a clinical paradox. So in gynecology, we recognize that hypoestrogenism and hypoandrogenism, such as during menopause, can produce this constellation of vulvovaginal and urinary symptoms that we now refer to genitourinary syndrome of menopause, or GSM. Yet postpartum and lactation individuals experience a very similar state of low estrogen and low androgens. But what's interesting is that this phenomenon has been observed clinically for decades. So many clinicians who care for postpartum patients have seen these symptoms in practice, and patients themselves describe them. However, until recently, there's been no unifying term to describe that constellation of symptoms in the context of lactation. And so without a name, the condition tends to remain diffuse and unrecognized and underdiagnosed. And so symptoms can much more easily be dismissed or attributed to simply a normal postpartum recovery, even when they are severe and persistent. So, first of all, our team wanted to name and characterize this condition, genitourinary lactation, or GSL. And why we felt that was important is because terminology shapes clinical recognition. And so by defining that syndrome, we hope to empower clinicians to identify and address the symptoms more proactively, and on the other side, empower patients by validating their experiences and making it more clear that effective treatments do exist. And so we wanted to explore GSL, genitourinary syndrome of lactation, by doing a survey of postpartum individuals themselves to get a better understanding of what do postpartum and lactating individuals experience, what are they struggling with, and what are their attitudes and perspectives, so that we can better, as clinicians, we can better tailor our care towards the issues that our patients are actually struggling with and care about themselves. Yeah, thank you for asking that question. There's two main findings that I'd love to highlight. The first is just the sheer prevalence of symptoms. So genital urinary symptoms were extremely common in our cohort. So particularly among lactating individuals, vaginal dryness was reported in over 80% of patients. Dyspareunia was reported over half of the time as well. So these findings reinforce that genitourinary symptoms in the postpartum and lactating period are not rare or incidental. They affect a substantial portion of patients and have a significant impact on their quality of life. And then the second striking finding I would love to highlight is the disconnect between symptom burden and treatment. So, despite this really high prevalence of symptoms, relatively few patients reported being offered treatment by their healthcare provider. So, in fact, more than half, about 60% of participants, were not offered any treatment at all. Yet patients reported that they independently sought out treatments themselves, such as over-the-counter products or other forms of therapy and resources outside of routine clinical care. And so, taken together, these findings highlight this significant communication and care gap in postpartum medicine. Patients are experiencing these symptoms, but conversations about their genitourinary health are not consistently being happening in clinical settings. And so this underscores a need for more proactive screening from the clinician side, so that postpartum individuals are not left to navigate these symptoms on their own.